Do you want to pass this exam on your very first try without any stress? Welcome to the CPHQ Exam Prep, the best place for you to learn quickly. Section 1 is Quality Leadership and Structure, which is a big part of your test. We are going to learn about leaders and how they help the hospital become safe. A good leader will always look at the numbers before making a very big decision. You must understand that the board of directors holds the main power in the hospital. The board makes sure that the quality of patient care is always the top priority. I want you to remember this, because they answer for the mistakes that happen here. When the hospital has a good plan, the doctors and nurses know what to do. This big plan is called a strategy, and it guides everyone on the right path. You need a clear vision and mission, so the team can reach the end goal. The mission tells the community exactly why the hospital exists, and what it will do. The vision is a dream for tomorrow, showing where we want to be next year. Values are the simple rules of behavior that keep everyone honest and safe at work. Leaders must give the team enough money and enough time to do the quality projects. If the leaders don't give money, the quality team will fail to fix problems. You should know that a leader must talk to the staff about the safety rules. We use a thing called a quality council to watch over the big safety plans. This group meets every single month to look at reports from the different hospital floors. They help the workers find the best ways to stop infections and to save money. Sometimes people do not want to change the way they do their work every day. A good manager will talk to them and explain why the new way is better. You must listen to their worries so they feel happy about the new safety rules. We call this idea change management, and it is a big topic on your exam. You need to train the staff well so they know how to use new tools. If they do not get good training, they will make errors that can hurt people. The managers should walk around the floors and talk to the nurses about their days. This helps the managers see the problems right when they happen in the real world. It also shows the workers that the boss really cares about their hard work today. Patient safety is a rule that says, we must not hurt the sick people here. Every person in the building must look for dangers that could cause a bad fall. When someone finds a hidden danger, they must tell the boss right away without fear. A just culture is a place where workers are not punished for simple human mistakes. We know that perfectly normal people can make a mistake if they are very tired. We only punish the staff members if they break the rules on purpose to hurt. When a bad error happens in care, we must find the real reason behind it. We use a tool called root cause analysis to see what broke in the system. We do not blame the tired nurse, we fix the broken machine or the rules. You should always look at the data to see if the hospital is getting better. Data tells the truth about the work, so you do not have to guess anymore. We put the numbers on a big chart so everyone can see the good results. A dashboard is a simple screen page that shows the most important numbers for today. It helps the top leaders see fast if a department needs more help or money. You will use these charts a lot when you become a certified quality worker soon. A team works much better than one person when trying to solve a hard puzzle. You should invite people from any jobs to join the quality team and share ideas. A doctor, a nurse, and a cleaner all see the hospital in a different way. This mixed team will find smart answers that one boss could never find all alone. I want you to make sure that everyone gets a chance to speak at meetings. A quiet person might have the best idea to stop a bad infection from spreading. You must respect the secret health facts of every patient that comes to the clinic. Do not talk about their private problems with your friends or your family at home. The law says we must keep it safe, or the hospital will pay a fine. Quality workers must follow the strict laws that come from the big government offices today. If we ignore these clear state laws, the hospital might get closed down for good. We do audits to check our work and make sure we follow every single rule. An audit is when you look closely at the records to see if things match. You check to see if the doctors washed their hands before touching the sick patients. If they forgot to wash their hands, you must train them again on the rules. Another big part of the quality job is to get the hospital ready for inspections. Inspectors come from outside groups to say, if we give the best care to people, we must always be ready for them, so we do not have to panic later. A smart plan is to do daily checks, instead of waiting for the last minute. Continuous readiness means we act like the inspectors are coming to visit us every day. This keeps the hospital safe all year, and the staff will not feel extra stress. I know this is a lot of facts, but you can learn it step by step. We will review these ideas many times, until you know them well in your head. You are doing a very great job, and I am proud of your hard work. Now we are going to look at the test questions that will help you pass. Read each question slowly and carefully, so you don't miss the tiny secret details. Think about what the best leader would do to keep the patients happy and safe. These questions are just like the real test, so please practice them a few times. I want you to get a high score and become a certified quality professional soon. Let us start with the first question and see how well you understand the lesson. 1. What is the very first thing to do when starting a new quality improvement plan? You must get the full support and approval from the top leaders of the hospital. Without support from the board of directors, the project will not save money or power. 2. Who holds the final responsibility for the quality of patient care inside a medical clinic? The governing body or board of directors is the group that takes the final blame. The board gives power to the medical staff, but the board still holds final responsibility. 3. How can a hospital leader show that they really care about the safety of patients? They should walk around the hospital floors and talk directly to the working staff members. Executive safety rounds help the leaders see the real problems that happen on the floors. 4. What is the main purpose of creating a just culture in a big healthcare organization? It creates a safe place where workers can report their mistakes without fear of punishment. We want to learn from our errors instead of hiding them from the angry managers. 5. Which group is responsible for looking at the quality reports from all the different departments? The Quality Council looks at all reports and makes big decisions for the whole hospital. This council connects the working staff members with the top leaders of the governing board. 6. Why is it important for the quality plan to match the strategic plan of the hospital? The hospital needs to work on the goals that match what the leaders want to achieve. If the plans do not match up, the team will waste money and lose time. 7. What document tells the public the main reason why the healthcare organization was built today? The mission statement is a short paper that explains the core purpose of the hospital. The mission talks about what we do now, while the vision talks about the future. 8. What is the best way to make sure that an improvement project lasts a long time? You should train all the new workers and write the new steps into the rules. When you make the change a policy, people will not go back to old habits. 9. How should a quality leader react if the staff members refuse to follow new safety rules? The leader should find out why the staff are unhappy and listen to their worries. Staff will resist changes if they feel that no one is listening to their problems. 10. What is the biggest barrier that stops a quality project from succeeding in a big clinic? A lack of support from top leadership is the most common reason why projects fail. If the boss does not care enough, the workers will not care about it either. 11. When planning a budget for the next year, what is the best tool to guide you? The strategic plan is the best tool because it shows the big goals for tomorrow. You should spend your money on projects that help you reach your big hospital goals. 12. Why do we need doctors and nurses on the same quality improvement team at work? A mixed team brings many different ideas and helps us see the full real picture. Different jobs give people different views, which helps to solve very hard medical puzzles faster. 13. What should a manager do if a good nurse makes a simple mistake by accident today? The manager should look at the system to find out why the accident happened today. In a fair and just culture today, we fix the system instead of blaming people. 14. Which statement describes a hospital vision correctly for the workers who want to understand it? It is a clear picture of what the hospital wants to be in 5 years. A vision inspires the team to work hard and reach for a very bright future. 15. If patient complaints go up very high suddenly, what should the quality director do first? The director should look at the data to find the main reason for the complaints. You must understand the real facts first, before you try to change the hospital rules. 16. What is the best way to prepare the hospital for a surprise visit from the inspectors? You should follow the safety rules daily, so the clinic is always ready for visitors. This is called continuous readiness at work, and it stops the staff from panicking later. 17. Who gives the final approval for the big strategic plan of the medical organization every year? The governing board gives the final approval because they hold the highest power in charge. The leaders make the plan together, but the board must say yes to the plan. 18. How can a quality professional help the doctors to follow the new rules for patient care? They should show the doctors the data that proves the new rules will save lives. Doctors love to see real numbers, and data will change their minds very fast today. 19. What does it mean when a hospital uses benchmarking to check its quality of care? It means they compare their own numbers with the numbers from other very good hospitals. Benchmarking helps you see if you are doing a good job compared to the best. Please leave suggestions in the comment section and get the full course in the description below. Section 2, welcome back to the next part of our CPHQ Exam Prep 2026 course. Section 2 is all about the data and how we use it to get better. We need to collect good numbers to see if the hospital is doing well. If you do not have good data, you are just guessing about the patient care. We use charts and graphs every day to show the doctors the real true facts. A run chart is a simple line that show things change over the time. If patient falls go up this month, the line on the chart will go up. This helps the busy managers say fast that we have a big problem to fix. We also use a control chart, which is like a run chart but much smarter. A control chart has a top line and a bottom line to show normal limits. If the data goes outside these limits, we know a special cause made it happen. We must find out what went wrong and fix it so it stays normal again. When you collect data for your project, you must make sure the numbers are correct. If you put bad numbers in, you will get a bad answer at the end. We call this idea data reliability, and it means we can trust the results completely. Validity means you are actually measuring the exact thing that you want to measure. If you want to measure hand washing, do not count the empty soap bottles today. You must watch the nurses wash hands to get the most valid numbers for sure. We take a small group of patients to learn about the whole big hospital population. This small group is called a sample, and it saves us a lot of time. You cannot look at every single chart, because it would take too many long weeks. You should pick a random sample, so the data is fair and not just biased. When we talk about the patient data, we use numbers like mean, median, and mode. The mean is just the normal average of all the numbers added up right together. The median is the exact middle number when you put them all in a straight row. The mode is the single number that you see the most often in the list. You will need to know these words to pass the big test on your try. Sometimes data is skewed to one side because of a very strange high or low. When data is crazy and very skewed, the median is the best number to use. The mean gets pulled by wild numbers, so it might trick you and tell lies. A scatter diagram is a dot chart that shows if two things are connected together. If the dots make a straight line, it means the two things move together closely. We call this connection a strong correlation, and it helps us find the hidden causes. A Pareto chart is a bar graph that helps us find the biggest hospital problems. It uses the 80-20 rule to show us where to start our work. You should fix the biggest bars first to get the best results for the patients. We must keep patient data very safe, so bad people cannot steal the private facts. You must lock your computer screen when you walk away to get some fresh coffee. If a hacker gets the patient data, the hospital will get a very big fine. I know numbers can seem very hard, but you will learn them with my help. We will practice these chart questions, so you feel ready and very confident today. Just take your time and read slowly, so the right answer becomes clear to you. Remember that we must collect the data before we start any new improvement project today. We call this the baseline data, and it shows us where we started the work. After we make a change to rules, we collect the exact same data once again. We compare the old and new numbers to see if our great idea actually worked. If the numbers got much better today, we know our plan was a big success. If the numbers stayed exactly the same, we need to think of a better plan. A good quality worker will never guess when they can use the clear hard facts. You must present the data very clearly so everyone can understand the story it tells. Use simple colors and clear big words when you show your charts to the board. Let us move on to the questions and test what you have learned right now. 20. What chart shows how a process changes over a long period of time today? Aaron chart is the best tool to see simple changes over the passing time. It plots the data points in order to help you see trends on a line. 21. Which chart has upper and lower limits to show what is a normal result today? A control chart has these limit lines to tell us if a process is stable. If a dot goes over the line, it means a special cause changed the process. 22. What does it mean when the data has a very strong and positive correlation today? It means that as one thing grows, the other thing will also grow with it. You will see this straight line shape when you look at a scatter diagram chart. 23. Why is the median better than the mean when the data numbers are very skewed? The median is not pulled away by one single crazy high or low number today. The median stays right in the middle, giving you a true picture of the data. 24. What rule does the Pareto chart use to help you find the biggest hospital problems? It uses the 80 and 20 rule to show the few things causing most trouble. You fix the tallest bar on the chart to solve most of the big problems. 25. What do we call the initial data collected before a new quality project starts today? We call this the baseline data because it shows the exact starting point for us. You need this starting number right now to see if your future changes actually work. 26. If you want to measure patient wait times, what gives you the most valid data? You should use a stopwatch to track the exact time the patient sits and waits. Validity means your tool measures the right thing, and a stopwatch tracks time very perfectly. 27. Why do we take a random sample instead of checking every single patient file today? A sample saves a lot of time and still gives us a very good answer. Checking every chart is too slow, and a random sample is usually very accurate today. 28. What does data reliability mean when you are doing a big quality improvement project now? It means you will get the exact same result if you measure the thing again. Reliable tools give the same steady answers, like a good scale weighing an apple twice. 29. What tool should you use to find out if long shifts cause more nursing errors? You should use a scatter diagram chart to see if the two things are connected. It plots the shift hours and the errors to show if a strong link exists. 30. What type of variation is considered normal and belongs to the everyday hospital system? Common cause variation is completely normal, and it is built right into the daily process. You cannot fix this normal variation easily, unless you change the whole entire system completely. 31. How should a manager react to a special cause variation on a control chart today? The manager must investigate the strange point and find out what went wrong that day. Special causes are not normal at all, so we must find and fix them fast. 32. What is the single number that appears most often in a long list of data? Themode is the number that shows up the most times in the data list. It is the most popular number collected, but we do not use it very often. 33. What must a quality worker do first, before sharing the hospital data with the public? They must remove all the private names and secret details of the sick patients first. The privacy laws say we must protect the identity of every person in the clinic. 34. If your control chart shows a steady flat line, what does this tell you today? A flat, steady line means your process is very stable and acting totally normal now. You do not need to fix anything, because the process is working just as expected. (35) When displaying data to the Board of Directors, what is the best rule to follow? You should keep the charts very simple and only show the most important clear facts. Busy leaders do not have much time, so a simple visual dashboard works the best. 36. What is the main benefit of comparing your data with other very good hospitals today? Benchmarking helps you set a higher goal and learn new tricks from the best places. It shows you what is truly possible if you push your team to work harder. 37. If you are tracking hospital infection rates every single month, which chart is the best? A run chart or a control chart is perfect for tracking data over the months. These charts are made for time tracking, so you can easily spot a bad trend. 38. How does a clear data dashboard help the top leaders of a big medical clinic? A dashboard gives a fast visual summary of the most critical daily numbers and facts. It acts like a car dashboard today, showing the speed and the fuel level fast. Please leave suggestions in the comment section and get the full course in the description below. Section 3. Welcome back to the third part of our big CPHQ exam prep course today. Section 3 is about making things better, and we call this performance improvement. We will learn about the best tools that help us fix the broken systems. When we find a big problem, we must use a clear plan to solve it. One very famous plan is called the Plan, Do, Study and Act cycle. We call this the PDSA cycle, and it is a very great tool. First we make a smart plan to see how we can fix the big mess. Then we do a small test to see if our new idea actually works today. We never test a brand new idea on the whole entire hospital at once. We study the test results carefully to see if the small change made things better. If the idea worked very well, we act and make it a new official rule. This cycle goes round and round until the process is perfectly safe and good. Another great tool we use daily is called the Lean method in quality work. Lean helps us cut out the waste, so we do not lose time or money. We want the work to flow smoothly, without any stopping or waiting around today. If a nurse walks too far to get some simple bandages for a sick patient, that long walk is totally wasted time, and we must move the supplies closer now. Lean makes the daily work easier and helps the busy staff feel much happier. We also use 6 Sigma tools to stop bad errors from happening in the clinic. 6 Sigma wants the daily work to be exactly perfect almost every single time. We use numbers and hard data to reduce the wild variation in the daily steps. 6 Sigma has its own cycle, which we call the DMAIC method for fixing things. You must define the big problem, measure it well, and analyze the deep root cause. Then you improve the broken system and control it so it stays completely fixed. Sometimes we want to stop a mistake before it even happens to a sick person. We use a smart tool called Failure Mode and Effects Analysis for this job. We just call it FMEA for short, and it looks into the future very closely. We look at a brand new process and guess what might go wrong with it. If we think a step will fail, we fix it before the hospital opens up. This is a proactive safety tool, because we act before the bad accident occurs. We also use a fishbone diagram to find the hidden causes of a past mistake. The head of the big fish is the bad problem that we want to solve. The bones are the different causes, like broken machines or very poor staff training. When you draw the fishbone out, the team can see all the connected moving parts. This helps us stop the blaming and focus on fixing the bad broken system today. Remember that good quality work is all about fixing the bad systems around us. We use flowcharts to draw out every single step of a process on a paper. A flowchart uses boxes and arrows to show how the work moves along the floor. This picture helps the whole team see where the work gets stuck or very delayed. You must train your team well on how to use all these great improvement tools. A team with very good tools can solve any hard puzzle in the big hospital. Please review these tool names again, so you will remember them on the big test. 39. What is the main goal of using the lean method in a hospital setting? The main goal of lean is to remove all the wasted time and wasted steps. Lean focuses on making the work flow smoothly without any useless delays or extra walks. 40. Which quality tool helps us guess what might go wrong before a new project starts? The failure mode and effects analysis helps us find risks before they even happen today. FMEA is a proactive safety tool that stops bad accidents from happening in the future. 41. What does the letter P stand for in the famous PDSA quality improvement cycle today? The letter P stands for plan, which is the very first step of the cycle. You must plan your small test before you try to change the rules at work. 42. Why do we do a small test during the do phase of the PDSA cycle? A small test keeps the risk low while we see if our new idea works. If the idea fails on one floor, the rest of the hospital stays perfectly safe. 43. What is the primary focus of the Six Sigma method in a big busy clinic? Six Sigma wants to reduce wild variation and make the daily process almost perfectly exact. It uses very strong data numbers to stop dangerous errors from reaching the sick patients. 44. Which quality improvement picture uses boxes and pointing arrows to show the work steps? A simple flowchart uses boxes and arrows to draw a clear map of the process. It helps the team easily see where the work gets totally stuck or delayed today. 45. In a fishbone diagram picture today, what does the head of the big fish represent? The head of the fish shows the main problem or the bad effect we see. The bones point to the root causes that created the bad problem in the first place. 46. What does the letter A mean in the SMART PDSA improvement cycle we use daily? The letter A stands for ACT, where we make the good change a permanent rule. We only act and change the rules if the small test gave us good results. 47. How does a flowchart help a team that is trying to fix a broken system? It gives a clear visual picture of how the work really happens on the floor. People can easily spot the wasted steps when they see them drawn on a paper. 48. Which tool is the very best for finding the deep root cause of a problem? The fishbone diagram is the best tool to brainstorm all the hidden deep root causes. It groups the different causes into categories, like broken machines or poorly trained staff members. 49. What is the first step you take in the DMAIC cycle for Six Sigma projects? You must define the big problem clearly before you try to fix anything at all. If you do not define the problem, you might waste time fixing the wrong thing. 50. What does the word proactive mean when we talk about patient safety tools at work? Proactive means we look for bad risks before the accident actually hurts a sick person. FMEA is a highly proactive tool because we guess the future dangers very early on. 51. How do you know if a PDSA, small test of change, was a big success? You must study the clear test data to see if the new numbers got better. We never rely on simple guessing because the hard numbers tell us the honest truth. 52. What happens during the measure phase of the Six Sigma DMAIC cycle for quality work? The team collects the baseline data to see how bad the current process really is. You need this starting number today to prove that your future fixes actually worked well. 53. What is considered a massive waste when using the lean method in a busy hospital? Having a nurse walk too far to fetch simple supplies is a massive daily waste. Lean tries to bring the tools closer so the nurse can stay right with the patient. 54. Why should we avoid changing a process across the whole entire hospital all at once? It is much too dangerous and risky if the new idea turns out to fail. A small pilot test is safer and helps us fix small bugs in the plan. 55. What does a team do during the improve phase of the Six Sigma DMAIC cycle? The team tests the new solutions and changes the broken steps in the daily work. This is where the real action happens and the bad problem gets fixed for good. 56. When using the FMEA safety tool today, what makes a risk score go very high? If a failure is extremely dangerous and hard to spot, the score goes very high. We must fix the highest scores first, because they can hurt the patients the most. 57. What is the main difference between a fishbone diagram and an FMEA safety tool today? A fishbone looks at past mistakes, while an FMEA tries to guess the future dangers. We use them at different times, but both tools help keep the hospital very safe. Please leave suggestions in the comment section and get the full course in the description below. Section 4. Welcome back to the fourth section of our big CPHQ exam prep course. Section 4 is about patient safety, which is the heart of our daily work. We must make sure every patient leaves the hospital healthier than they arrived today. You must build a strong safety culture so workers feel happy to share problems. If a nurse makes a mistake, we do not shout or get angry instantly. We thank them for telling us, and we're trying to fix the broken system. This honest sharing helps us stop the exact same mistake from happening tomorrow morning. We use an incident report form every time something goes wrong on the floor. This form is not a punishment. It is a tool to collect safety data. A near miss is a bad event that was caught just before it happened. If a doctor almost gives the wrong pill, that is a lucky near miss. We must study these near misses closely, because they are free lessons for us. They show us where the system is weak, without hurting any sick patients today. One of the biggest safety goals is to give the right medicine every time. You must always check the patient name and their birth date before giving pills. We use barcodes on the medicine bags to make sure the match is perfect. If the scanner beeps a red warning, the nurse must stop the work instantly. Another huge safety goal is stopping bad bugs and infections from spreading around. Washing your hands with soap and water is the best way to stay clean. You must wash before touching a patient, and right after you finish your work. We also watch out for patient falls, because a bad fall can break bones. We put yellow socks on patients who might feel very dizzy when they stand. The yellow socks tell every worker to watch that patient very closely all day. Sometimes we have a sentinel event, which is a very terrible and deadly mistake. This is an unexpected bad accident that causes death or very serious physical harm. If this happens, we must act fast and do a root cause analysis immediately. We must find the deepest system failure, so this tragedy never happens again here. Human factors engineering is a smart science that helps us build much safer tools. It knows that humans get tired, and we will press the wrong button sometimes. So we design medical machines carefully, so the wrong button is hard to press. We use forced functions in our work, which make it impossible to skip steps. If you cannot plug a gas tube into the wrong wall hole by mistake, that is a forced function design, keeping the sleeping patient perfectly safe and sound. We also use daily safety huddles to talk about the dangers of the day. A huddle is a short, fast meeting where the team stands in a circle. They talk about the sickest patients and the broken machines that need fast fixing. This quick morning chat keeps everyone awake and ready for a very safe shift. We must teach the new staff members how to lift sick patients safely today. If they lift with their weak backs, they will get hurt very fast. We use special lifting machines now to move heavy patients from the beds safely. This protects the hard-working nurses from getting bad injuries on the job. Safety is not just for the patients, it is for the workers too. When the staff feels completely safe, they give much better care to everyone. We check the fire alarms weekly to make sure they ring very loud. We practice fire drills often, so we know exactly where to run outside fast. Every tiny detail matters greatly when we are saving lives in the medical clinic. Remember that safety is every single person's job, from the cleaner to the boss. We must all speak up loudly if we see a dangerous thing happening today. Now we will move to the questions, so you can test your safety knowledge. Read carefully so you do not miss the secret clues in the text. 58. What is the main purpose of filling out an incident report at work? The report helps us collect safety data, so we can fix the broken system. It is never used to punish workers, it is only used to learn facts. 59. How should a manager treat a worker who reports a lucky near miss today? The manager should thank the honest worker for finding a hidden danger so early. Praising the worker builds a good safety culture and encourages more honest reporting later. 60. What is a sentinel event inside a busy medical clinic or a hospital? It is a terrible, unexpected accident that causes severe harm or patient death today. These extreme events need a fast investigation to stop them from ever repeating again. 61. What action must follow right after a sentinel event happens on the floor? The team must do a root cause analysis to find the deep system failure. We must understand the exact broken steps that allowed the tragedy to reach patients. 62. Why do we put yellow socks on certain sick patients in the hospital beds? The yellow socks are a visual warning that the patient might fall down easily. It helps all the busy passing staff to watch that person very closely today. 63. What is the single best way to stop dangerous infections from spreading around? Washing your hands with soap properly is the most effective way to stay clean. Hand hygiene kills the bad invisible bugs before they jump to the next patient. 64. How many patient identifiers must you check before giving out any new medicine pills? You must always check at least 2 different patient identifiers before giving the medicine. We usually use the full patient name and their official date of birth together. 65. What is the meaning of a forced function in human factors engineering design today? It is a hard physical rule that makes a bad mistake completely impossible today. For example, you cannot fit a large plug into a very tiny wall socket. 66. Why do nurses use barcode scanners when giving medicine to a sick person? The scanner checks the digital computer system to make sure the match is perfect. If the drug is totally wrong, the loud machine will beep a red warning. 67. What is a daily safety huddle for a busy medical team at work? It is a short morning meeting to discuss the big dangers of the day. It keeps the whole team fully awake and aware of the broken machines around. 68. Who is responsible for patient safety inside a large modern medical clinic today? Every single worker in the building is fully responsible for keeping the patients safe. From the top cleaning staff to doctors, everyone must report the hidden physical dangers. 69. What happens if a hospital ignores a culture of safety on the floors? The workers will hide their daily mistakes, and the patients will get hurt badly. Fear of punishment makes people tell lies, which destroys all the quality improvement plans. 70. What does human factors engineering try to understand about the daily hospital work? It studies how tired and normal humans interact with heavy machines and strict rules. It tries to build much smarter systems that easily forgive normal human brain errors. 71. Why are near misses called free lessons for the hospital quality improvement team? They show us the broken system flaws without causing any real harm to patients. We can fix the bad safety rules before a deadly accident actually happens tomorrow. 72. If a doctor forgets to wash hands, what should the quality manager do first? The manager must quietly remind the doctor and train him on the safety rules. We must fix the unsafe behavior fast to protect the vulnerable sick people inside. 73. What is a timeout in surgery before the doctor makes the first cut? Everyone stops moving in the room to confirm the right patient and body part. This short pause stops the tired doctors from cutting the wrong leg by mistake. 74. Why should an incident report form be very easy and simple to fill out? A simple form saves precious time, so busy nurses will actually use it daily. If long form takes an hour, the tired staff will just ignore it. 75. What is the biggest warning sign of a very poor patient safety culture? When workers are afraid to speak up about the dangerous things they see daily. Silence is a very bad danger sign, because hidden problems will grow much bigger. 76. How does a blame-free culture help the quality improvement team at work? It brings all the mistakes into light, so the team can fix the bad systems. When people are not afraid of anger, they share the honest truth much faster. Please leave suggestions in the comment section, and get the full course in the description below. Section 5. Welcome back to the 5th section of our big CPHQ exam prep course today. Section 5 is about accreditation and the strict rules we must follow. Hospitals must prove they are good to get a special seal of approval. This special seal is called accreditation, and it proves we are very safe. The Joint Commission is a big group that visits hospitals to check our work. If we pass their hard test, they give us the shiny gold seal. We must follow all their rules, so the government will pay our bills. Medicare is a government health plan that pays for older sick people today. Medicare will only pay the hospital if we have that shiny gold seal. Getting ready for the big inspectors is a huge part of the quality job. You must never wait until the very last minute to start checking rules. We use a smart plan called continuous readiness to stay perfectly prepared daily. This means we act like the inspectors are coming to visit us every morning. We do mock surveys and practice to see if the staff is ready. A mock survey is a fake test where we pretend to be the inspectors. Another big job is checking the doctors before they work in our hospital. We must make sure they have a real medical degree and good skills. This deep background check is called credentialing, and it takes a long time. We contact their old medical schools to see if they really graduated there. We also check the state license to ensure it is completely active today. If a bad doctor has a fake degree, they can hurt a sick patient. After we check their past school papers, we give them permission to work. This permission is called giving privileges, and it tells them what to do. A heart doctor gets different privileges than a bone doctor on the floor. We check the doctors again and again, every 2 years, to be perfectly safe. This second check is called recredentialing, and it is a very strict rule. We look at their recent patient data to see if they make mistakes. If a doctor makes too many errors, we might take their privileges right away. We must protect the innocent patients from a doctor who forgets the rules. We also follow strict privacy laws to keep patient secrets perfectly hidden today. HIPAA is a big strict privacy law that protects all the secret medical files. You cannot look at the medical file of a famous person on the news. You can only look at the file if you are treating that specific patient. If you peek at private patient files, you will get fired very fast today. The government will fine the hospital a lot of money for broken rules. Quality workers train the whole staff to respect the strict HIPAA privacy laws. Policies and procedures are big rule books that tell the staff what to do. A policy is a strict rule, and a procedure shows the exact steps. We must update these big rule books every few years to keep them fresh. When new medical science comes out today, we change the old hospital rules completely. The quality team helps the top leaders to write these new rules very clearly. We must read the new government updates, so we do not miss new laws. I know this is a heavy topic, but you are doing wonderfully well today. The rules keep the Wild Hospital completely organized and very safe for all. Let us look at the new questions to test your knowledge right now. 77. What is the main reason why hospitals want to get the shiny accreditation seal? It proves to the public that the hospital provides very safe and good care. The government also requires this seal so they can pay the hospital bills today. 78. What does continuous readiness mean for a busy hospital quality improvement team today? It means staying completely prepared for inspectors every single day of the year. This stops the staff from panicking when surprise inspectors arrive at the front door. 79. Why do we do a mock survey before the real inspectors come to visit? We do a fake practice test to find our hidden mistakes very early. It helps the staff practice their answers and fix the broken rules in time. 80. What is the very first step before a new doctor can treat patients here? We must complete a deep background check, which is called the credentialing process today. We must verify their medical school degree to make sure they are totally real. 81. What does it mean when a hospital gives a new doctor clinical privileges today? It means we give them permission to do very specific medical jobs and surgeries. A doctor can only do the specific tasks that match their past medical training. 82. How often must a hospital recredential a working doctor to keep patients completely safe? We must check the doctors again every 2 years to ensure they remain safe. We look at their recent surgery data to see if their skills are dropping. 83. What happens if a doctor loses their clinical privileges inside a big medical clinic? They are not allowed to treat patients or perform surgeries in that hospital anymore. This happens if they make too many errors or break the big safety rules. 84. What is the main purpose of the strict HIPAA privacy law in the clinic? HIPAA protects the secret health information of every single patient in the building today. It stops bad people from stealing private health details and selling them for money. 85. Can a nurse look at the medical file of a friend who is sick? You can only look at the file if you are treating that specific patient. Peeking at a friend's secret file is a big violation of the strict laws. 86. What is the main difference between a hospital policy and a hospital procedure today? A policy is the strict hospital rule, while a procedure gives the exact steps. The rule tells you what to do, and the steps tell you how to. 87. Who makes the final decision to give clinical privileges to a new hospital doctor? The governing board makes the final choice, based on the medical staff committee advice. The board holds the highest legal power, so they must approve the new doctors. 88. What is primary source verification during the long doctor credentialing process at work? It means we contact the medical school directly to check the doctor's paper degree. We never trust a paper copy because a bad doctor can fake a copy. 89. Why do quality leaders review the hospital policies every 2 or 3 years today? They must update the old rules to match the brand new medical science discoveries. Old medical rules can become very dangerous if the science changes fast over time. 90. What should a staff member do if the state inspector asks a hard question? They should tell the honest truth and show the inspector the written policy book. If they do not know the answer, they should offer to find the manager. 91. What is the National Committee for Quality Assurance known for in the medical field? This big group provides strict accreditation for big health insurance plans and medical groups. They use special data measures to see if the health plans are truly good. 92. Why does the Medicare program require hospitals to pass a strict accreditation survey today? Medicare only wants to pay for care if the hospital is proven completely safe. It protects the taxpayer money from going to very bad and dangerous medical clinics. 93. What is the best way to train staff on a brand new hospital privacy rule? You should hold small team meetings and let them practice the new daily steps. Hands-on practice is much better than just reading a boring long email today. 94. If a doctor wants to learn a new surgery, what must they do first? They must get special training and then ask the board for new clinical privileges. A doctor cannot just try new things without getting official permission from the board. 95. How does a mock survey help the hospital leaders during the continuous readiness plan? It gives the top leaders a clear report showing where the staff needs help. Leaders can spend money to fix problems before the real inspectors find the mess. Please leave suggestions in the comment section and get the full course in the description below. Section 6. Welcome back to the final part of our big CPHQ exam prep course today. Section 6 is about sharing facts and teaching the staff to be very smart. You have learned so much already, and we are almost at the finish line. We must talk about the computers that hold all the secret patient files today. Electronic health records are big systems that replace the old paper medical files completely. These computer systems help doctors share important patient details with other nurses very fast. When a doctor types a prescription, the computer checks for bad drug mixing instantly. This smart check stops a mistake before the sick patient even takes the pill. You must make sure the system is always working fast without any computer bugs. If the computers go down suddenly, the hospital must use paper files to survive. We call this a backup plan, and we must practice it to stay safe. Information management means we keep data perfectly organized and safe from bad internet hackers. A big part of your job is teaching adults how to use these systems. Adults learn very differently than children because they bring past experiences to the class. You must tell an adult exactly why they need to learn this new rule. If they see the real value, they will pay attention to your safety class. We use hands-on practice daily because doing a task is better than reading. Do not just talk at him, let them press the buttons on the machine. After you teach a new skill, you must check to see if they remember. We call this checking their competency to make sure they are totally safe workers. You can watch them wash hands, toes if they follow the exact steps. If they do the steps wrong, you must gently correct them right away today. A quality worker must always be very honest and follow the highest moral rules. We call this good professional ethics, and it means doing the right thing always. Even when nobody is watching you, you must wash your hands and work hard. If you see a doctor cheating, you must tell the boss to protect patients. We never hide a bad mistake, because the truth helps us fix the system. We must also talk about surveys that ask the patients if they're happy. Patient satisfaction is a huge goal, because happy people heal much faster at home. We send a letter to them after they leave the big clinic to rest. The letter asks if the nurses were nice and if the room was clean. If the scores are very low, we must train the staff to smile more. We want to be the best place for sick people to get well today. You will soon take your test and become a certified quality professional very soon. I am so proud of you, because this work is hard but very rewarding. You will help save many lives by making the hospital a much safer place. Take a deep breath and relax, because you have all the knowledge you need. Read every test question very slowly, and think about the safest choice for patients. Now let us finish the questions, so you can complete this big prep course. 96. What is the main benefit of using electronic health records in a big clinic? They allow doctors to share facts instantly without losing old messy paper files today. Computers help stop simple reading errors and make the daily hospital work much faster. 97. How does a computer drug alert keep a sick patient very safe from harm? It warns the busy doctor instantly if two drugs will cause a bad reaction. This smart computer check stops doctors from making a deadly mistake with the pills. 98. What must a hospital do if the main computer system suddenly crashes completely down? The staff must switch to using the emergency paper backup files to continue working. You must always have a backup, so the patient care never stops or delays. 99. What is the very best way to teach adult workers a brand new skill? You should use hands-on practice, so they can try the steps right away. Adults learn best by doing things, instead of just listening to a boring lecture. 100. Why is it important to explain the reason behind a new hospital rule today? Adult workers will only follow rules if they understand why the rule is helpful. If they see the true value, they will not resist the big new change. 101. How do you check if a nurse is truly competent at doing a job? You must watch the nurse work to see if they follow the exact steps. Simply passing a written paper test does not prove they can do physical tasks. 102. What is the meaning of professional ethics for a certified hospital quality worker today? It means you always tell truth and do what is right for the patients. You must never hide bad data, even if the angry boss tells you to. 103. Why do hospitals send satisfaction surveys to patients after they go back home today? To find out if the patients were happy with the care they got here. Happy patients are a big sign that the hospital provides very high quality care. 104. What should a manager do if the patient satisfaction scores drop very low suddenly? The manager must review the feedback and fix the specific things patients hated most. If patients say rooms are dirty, you must talk to the cleaning staff fast. 105. How does sharing data across departments help the whole hospital improve its daily work? It stops people from hiding facts and helps everyone solve the hard puzzles together. When departments talk to each other, they find the best answers much more quickly. 106. What is the biggest risk of using a digital medical record on a computer? A bad internet hacker could steal the private health secrets of the sick patients. Hospitals must use very strong passwords to keep the digital data perfectly locked away. 107. Why do we group adult learners into small classes instead of huge big rooms? Small groups allow everyone to ask their questions and practice the skills much better. Huge rooms make people very shy, and they do not learn the steps well. 108. What should you do if an adult learner makes a mistake during safety practice? You must correct them very gently and show them the exact right way again. You want them to learn safely, without feeling embarrassed in front of their friends. 109. What is a key step in protecting hospital computers from dangerous outside hackerviruses? You must update the safety software and tell workers not to open bad emails. Most bad viruses enter the hospital when a tired worker clicks a fake link. 110. How does a clear communication plan help a big quality improvement project succeed today? It keeps every single worker informed, so nobody is surprised by the new rules. Good talking stops bad wild rumors and keeps the team happy and very calm. 111. What is the best way to share a big safety success with the hospital? You should post the good numbers on a big public dashboard for all staff. Seeing the big win makes people feel proud of their very hard daily work. 112. Why should a quality professional keep learning new medical facts every single year today? Medical science changes very fast naturally, so you must keep your brain completely updated. If you stop learning new things, your quality advice will become dangerous and wrong. 113. What happens to a quality leader who lies about the hospital infection data numbers? They will lose their professional certification, and they will probably be fired right away. Honesty is the most basic rule for anyone who works in patient safety today. 114. What is the ultimate goal of becoming a certified professional in healthcare quality soon? The ultimate goal is saving lives by building a perfectly safe medical system today. Your hard work stops deadly mistakes and helps sick people return to their families. Please leave suggestions in the comment section and get the full course in the description below.